My name is Trey Goodwin. I'm a physical education teacher at Weber Elementary School in Eastover, South Carolina. I teach grades pre-K through 5th grade. Pretty much I just teach them the basics of physical education and health and fitness. It's a rural school, small town of Eastover. I'm from this area. It means a lot to me. School maybe has 200 kids in it. Majority of them are low-income households. Pretty much not really much going on around here, so the kids really enjoy coming to school and just getting to learn and actually see their friends and do different things around here.
When we first started our telehealth education program, we did a traditional telehealth education where we would be in our offices at Prisma Health, and then we would have some equipment to provide education and clinical programs to students in a rural area where there's a lot more challenges to get to appropriate health care and to access quality health education.
One thing that I include in my lessons, just to make sure that they understand the importance of eating healthy, balanced meals instead of just junk food. But a lot of times, some kids don't have the means to get those healthy foods, so I try to explain to them the best way possible.
So the education was that we would provide the instruction in our offices between us and also South Carolina Department of Health and Environmental Control to provide 16 lessons of physical activity and nutrition type of curriculum. So we did that for a few years and everything worked really well. We've got proven results of really that knowledge learn. We increase students' physical activity for at least 10 minutes every week because we utilized online activities for them to get up, running, moving around. So we really were able to increase their knowledge of health education awareness. And then COVID happened. So once we figured out during the summer of 2020, we were all put our minds at work and said, how can we deliver quality education even with students not in schools? We worked with Richland County District 1 and DHEC, and we decided to provide on-demand videos.
We'd go into the studio and we would record kind of like we were pretending like we were speaking to the students, but really, they weren't there. But we would do these lessons and we had to come up with all these scripts of what were we going to talk about, and also how are we going to get all of that information from 30 minutes into 5 to 7 minutes. So we really just kind of, like I said, revamped the telehealth education program and made it accessible to students even though they were at home, and then we got them out to the students by their PE teachers.
It's helping it a whole lot. I think it's very important for them to see other people stressing the same things that I'm stressing, because most times children, they'll take something from other people better than what they would from others.
One of the students' favorites is the workout lesson that we do. We break it down into the 3 different parts of a workout, your warm-up, your actual workout, and then your cool-down. One that talks about bone strengthening and muscle strengthening. How much sleep do I need is one of our other topics. And that one talks about making sure that the students get their allotted amount of time at night. Previously, we reached about 250 to 300 students. Now, we went from 250 to 300 students to 850 to 900 students.
I show them on the screen. Kids here would do it, including the kids that's still on virtual. So it's pretty much the same thing. And then I'll still post it on their team with my class so they can access it at any time they want. Me personally, I love it. Growing up, we didn't have a program like this. So I think it's a blessing, honestly. So the kids can just see and hear different people talking about it, different professionals talking about it. So they can actually say, okay, people know what they're talking about. And then once they go and do it, then they actually can feel, okay, all right, so I know what they were talking about now. Sleep does help me perform better in class. Eating my breakfast really does help me perform better in class. So I personally love it, and it's a blessing.